Okay, now that we've talked about the pre-renal and intrinsic or intrarenal causes of AKI, let's talk about the post-renal. So basically anything that happens after the kidney. So we have the ureters here, we have the bladder, males we have the prostate, and then we have the urethra. Now, anywhere there's a blockage here, that can cause backlog and subsequently cause damage. So let's look on the right side. Most common one is, let's say, a kidney stone, or at least most commonly well known, a kidney stone or nephrolithiasis. Basically can cause blockage of the ureters, and then you can get an enlargement called hydroureter. And if it's severe enough, it can also block, goes back into the renal pelvises and cause enlargement there and causes damage to these nephrons and the tubular cells with all that pressure because it's like a tube that can't drain properly, right? So this would be considered a upper tract obstruction. Now, you could also get pelvic trauma. Let's say you were in a car accident and fractured your pelvis or had some other problems here. That would also cause backlog of the urine, and that would cause problems to the kidneys. Now, if we go lower down, same thing. If the bladder can't empty properly, because maybe you have a neurogenic bladder, that also can cause backlog. Or men, prostate, if you have a large prostate, you can't pee well, and again, you can't empty well. Again, backlogs into the bladder, backlogs into the ureter, backlogs into the kidneys. Finally, further down, if we have a urethral stricture, males or females, we have a stricture, somehow then that could, again, backlog up the bladder, up the ureters, back into the kidneys. So there you have it, basically a very logical way of thinking about post-renal AKI.